It's your fault, actually. It's your fault. It's your fault that I didn't get 18 correct. I was recently sent this advanced sex ed quiz, and I'm interested to know how many I, as someone who presumably should be advanced in sex ed knowledge, can get correct. How often should you take an HIV test if you're sexually active? Right out the gate, I'm going to state that this is not a fair question because the answer depends on the person who is taking the test. Once a month, every 6 months, once a year at least, or every 3 years. This is a really not fair question because if you're sexually active but in a monogamous relationship with a partner who is also monogamous, then you don't really need to have repeat HIV tests. Okay, I'm overthinking it. Just pick an answer.
One eternity later.
Yearly, at least, purely based on the fact that at least could also encompass the every 6 months and every month. So just from a standpoint of multiple choice question taking strategies, that's going to be the most correct, even though it's an unfair question, as I stated. Correct. Who should have a HIV test? Well, everybody should have one at least once as part of routine health screening. If you're sexually active, both of you had a negative test before you started having sex, and you're both monogamous, then yearly testing isn't necessarily recommended. That being said, if you fall into a high-risk category, it may cause you to want to be tested more often. It's not quite as simple as that question made it out to be. What should you do if you miss a dose of progestin-only birth control pills? Use a backup method for the next 2 days, throw out the pill pack and start a new one, take an extra pill to make up for it, or nothing. Definitely not nothing. For progestin-only pills, these are going to be a lot more sensitive to missing pills even by just a few hours. So the answer to this one is going to be using a backup method for the next 2 days. Now, if you're taking combined hormonal birth control pills that have estrogen and progestin, if you miss a pill, as long as it's been in the past 48 hours, then you just go ahead and take the pill when you realize it and take your next dose at the same time that you normally would, even if that means taking 2 pills at one time. If it's been more than 48 hours, meaning you missed more than 2 pills, then you need to go ahead and take an extra dose, your regular dose, and use a backup method for the next 7 days. And if you miss a pill in your first week of using a pill pack, then you probably should go ahead and just use a backup method for 7 days, no matter what kind of birth control that you're on. For the progesterone-only pills, it's so sensitive. So even if you only miss it by 3 hours or more, you should absolutely still use a backup method of contraception like a condom or not having sex for at least the next 2 days. If someone with a cervix tests positive for high-risk strain of HPV, what's the typical next step? The next step in this case would be doing a colposcopy, which is looking at the cervix with a microscope to seeing if any of the cells look abnormal and potentially taking biopsies if they do appear abnormal. So for the answers here, additional screening, prescription medication, hospitalization, or follow-up in a year, the answer is going to be additional screening. We don't test for HPV in everyone, so it's a pretty specific population because less than age 30, a lot of people, most people at some point in that time frame between like 15 and 30 will test positive for HPV, and most of the time your body clears that on its own. So we don't generally start testing for HPV routinely until you're over the age of 30, and then we would do that with your pap smear screening at your appointment. Oh, and by the way, I have a full 3-video series on HPV vaccines, and a Q&A. If you want to check that out, I will link it in the description box below. It might answer some of your questions if you have them. True or false? It isn't safe to take a birth control pill if you're over 35 and smoke. These questions are poorly written. I'm going to say true because if you're over 35 and smoke, you shouldn't be on birth control, but you should still take progestin-only pills. So that's going to be the point here. Overall false statement is partially true. Birth control pills with estrogen, also called combination pills, aren't a safe choice for women over the age of 35 who smoke. And the reason for this is that the estrogen component combined with the tobacco smoking increases the risk of deep vein thrombosis or a blood clot in the leg or lung, or leg that travels to the lung, is significantly increased by being over 35 on an estrogen-containing pill and being a smoker. But the progestin-only pill is fine because it doesn't have that estrogen component to increase the risk of blood clots further. Fill in the blank. Every year, 24,000 American women will blank because of undiagnosed STIs. I do not know the answer to this one because the certain sexually transmitted infections can be related to all of these things. I guess we will go with become infertile because 24,000 is a pretty big number, and most of the time when you're diagnosed with cervical cancer, you know that you have HPV. That's part of the diagnosis process. So you wouldn't have an undiagnosed STI. Okay, I'm gonna go with that one. That says, yeah, I don't know. I don't like the wording of this question. So untreated STIs, chlamydia, gonorrhea, potentially can increase the risk of infertility. But again, like I've said in many videos, I would never ever tell someone you have chlamydia that went untreated for, I don't know, 6 months, now you're infertile. We don't know that for sure. PID, or pelvic inflammatory disease, chlamydia, gonorrhea, other pelvic infections that get from the vagina up into the tubes can definitely cause infertility. It's not like a 1-for-1. Just because you had it doesn't mean you're definitely infertile. So just as an aside. What is the most effective form of emergency contraception? I know this one, and you should too if you watch my emergency contraception video. So we're going to go with copper IUD. Excellent job. I'll link my emergency contraception video in the iCard and down below. If I remember, I always forget, for you to watch if you'd like to. Who is more likely to experience STI symptoms? People with penises, people with vaginas, genders experience STI symptoms equally. People who have a penis are definitely more likely to have like burning with urination and discharge when they have an STI, sexually transmitted infection. You can still have symptoms though if you have a vagina, but I think it's people with a penis are more likely, yeah. What's the average amount of blood lost during a period? It's definitely not any of these high numbers, so we're going to go with 2.7 ounces. Yeah. I know, it looks like more than that. And for some of you it is, because you have abnormally heavy periods that you should bring up and discuss with your doctor or advanced practice provider, but it's really not as much as it seems when it gets into the toilet. What is the average length of a penis when erect? I do not know this question. This is not in my field and quite literally do not particularly care the answer to this, but I don't know. Let's go with, it's probably either 6.3 or 5.1, but let's go with 5.1. I didn't think I would get that right. I guess this is important to people who have a penis. I have never even considered measuring a partner's penis, but there you go. If you're trying to get pregnant, when should you and your partner see a fertility specialist for help? This is also not a fair question because this varies by the person, but all right, before you start. No, you don't need to see it before you start unless you are in a same-sex relationship, in which case trying to get pregnant without the help of a fertility specialist would not make any sense. Again, these are not good questions. After 3 months of trying, not necessarily. After a year of trying, yes. They have it depends. It's got to be it depends. A year of trying would be for a heterosexual relationship, both partners are healthy and you're both under the age of 35. Yeah, it depends. Yes. Okay, I take it back. This is a good question because it's true. The standard advice under 35 is to wait a year before seeing a specialist. Again, this is strictly for heterosexual relationships. Women over 35 should wait for 6 months, and over 40 should be as soon as they get started trying to conceive. However, it varies depending on your individual health. Women with irregular cycles shouldn't wait to see a specialist. But I'm really disappointed with the lack of non-heteronormative couples in this entire quiz so far. When did herpes become a common infection? Oh, this was like forever ago, right? Weren't there like tons of kings and queens who knew they had herpes? Yeah. Scientists believe that herpes jumped from chimpanzees to human ancestors 1.6 million years ago. I don't even think that I knew that. But herpes wasn't considered a big deal until media hysteria in the 1970s and 80s created fear and stigma around it. It is quite frustrating because some people feel incredibly devastated to get the news that they have been diagnosed with herpes, and it's an incredibly common diagnosis. The stigma really makes it difficult on people to process a medical diagnosis that's manageable and move forward. So destigmatize herpes. I mean, don't get it, protect yourself. But if you do, it's fine, we can manage it. What's your best protection against HIV during anal sex? Condoms, PrEP, lube. All right, this is not a fair question either because it's condoms, unless you're having sex with somebody that you know is HIV positive, or if certain people fall into a different group. But lots of people can have anal sex and their best protection would be condoms. You wouldn't just be on PrEP, which is a preventative HIV medicine, but PrEP would technically be more effective than condoms, even though most people are not going to have access to that. So I guess I'll say PrEP. Don't like that question. Not fair. New RX, not making me happy with the fairness of these questions. How long is a vaginal canal on average? It's weird to see this in inches. Also of note, when aroused, the vaginal canal lengthens significantly due to relaxation of smooth muscle and other tissues in the body. However, I've never seen this done in inches. So think like 9 centimeters. Gosh, the metric system. I am in New Zealand and we use a metric system. I should be good at this. 2.5 centimeters per inch. 3.5.
Math is hard.
We're gonna go with 3 to 4. Yes. I'm not very good at math or conversions, and I'm really proud that I managed that. True or false? A vaccine will keep your penis healthy. Well, a HPV vaccine certainly could help keep the penis happy. Oh, it says healthy, I said happy. Whatever, same thing, right? Happy penis is an HPV-free penis. That prevents several types of HPV, many of which can cause penile cancer, so we're gonna go with true. Yes. Again, I have a whole series on HPV and HPV vaccination. I will link it in the description box down below. How many people in the US are infected with oral herpes? This has to be a lie. That's got to be 1 in 2, 1 in 4. I think it's probably 1 in 2, 1 in 4. I don't know. All right, I should have gone with my gut. I thought it was 1 in 2. 50% of people have oral herpes. That's like cold sores, really, really common. Which of these is a risk of taking emergency contraception often? Acne? No. Infertility? No. Unplanned pregnancy? Absolutely. Lower sex drive? I don't think so. Okay, unplanned pregnancy is for sure, because if you're frequently using emergency contraception, it means that you are not reliably using a more reliable form of contraception. So for sure, that's the answer. Please use Plan B and other emergency contraceptions as a backup only, and for your primary method of pregnancy prevention, something that's more reliable. True or false? Your period can sync with your roommate's cycle. Oh, I'm gonna break the hearts. We've talked about this in another video. This is a myth. It can't really happen. I know you disagree, but there's a lot of science on it. It doesn't really happen, and it just comes down to chance, right? Because if you think about your roommate and you both have a period, you both bleed for 7 days a month, the chances of that happening, overlapping at some point in those 7 days, is relatively high, and the higher number of roommates you have, the more chances it are that some of those days are going to line up. So you don't sync your period with your friends. I'm sorry. Oh, and I just told you it was false, and then I clicked true. So this is why we don't talk and make YouTube videos while we're taking a test. Which region of the country reports the highest rates of chlamydia and gonorrhea? I think this has got to be the South. Having trained and worked most of my career in Texas, I'm almost certain that it's the South. Sex education is poor. It's not because people in the South are stupid or more promiscuous. It's because they are not taught to protect themselves. There is no discussion about condoms, about safety, about testing, about partner prevention. It's an education thing. 100%. True or false? Every sexually active person should be tested for herpes. Absolutely not. No herpes testing unless you are symptomatic. Why? Herpes testing is notably unreliable. There is no treatment for asymptomatic herpes, and it can be confusing. So only test for herpes if you have an outbreak. So if you have some kind of genital ulceration, then come in and we will do a swab and see if it's herpes. If it's herpes, we will treat it and talk to you about how to prevent outbreaks in the future, and also how to prevent passing that along to a partner. How should you clean the vagina? Nope.
No! God, please, no! No! No!
I haven't read the answer options, but this better be not cleaning it. No douching. Don't do it. Gentle soap and washcloth. Definitely not like that. Please don't put a washcloth in your vagina. Vaginal steaming, we've talked about in another video. Fine as a cultural practice, absolutely not as appropriation or for someone to take your money unnecessarily. You don't need a vaginal steam to clean your vagina. You shouldn't clean your vagina. Thank you. I am so happy they had that as an answer. Very much appreciate it. We're done. 17 out of 20 correct. Although I will say one of those I correctly answered, but I clicked the wrong one. And I'm pretty sure I had this conversation with a professor in medical school, and they said,
it doesn't matter. You put the wrong answer, you don't get the question right.
And that's true. That's why we pay attention. And my ADHD sometimes didn't allow that, but today it's your fault, actually. It's your fault. It's your fault that I didn't get 18 correct. All right, y'all, I hope that you learned something today. If you did, leave a like on this video. I will link a whole lot more videos right over here so you can laugh and learn and get to know me a little bit better. If you're new and you'd like to subscribe, we would love to have you hit that subscribe button, turn on notifications so you never miss an upload. I'll see you next Monday.